Hello and welcome to today's episode on Life Saving Aid. Today we are going to be looking at heat stroke in children and what we can do to help reduce complication and increase their chances at survival. It's important we know that heat stroke in children is a medical emergency, and if the right actions are not taken as soon as possible, the chances of survival become significantly reduced. This is a condition that is very common when the weather is hot. How do we recognize a child that is having heat stroke? First, when you touch their body usually used to be very hot. And when you use a thermometer to take their body temperature, you usually get values from 40 degrees Celsius and above. How do you differentiate heat stroke from other form of fever? Because in both situations, their body temperature will be very high. It will be hot. So how do you differentiate? For those that are not having heat stroke, they usually present you see other symptoms like cough, catarrh or runny nose, abdominal pain, vomiting, diarrhea. There are other symptoms that point to the sign of an infection going on or something else. Okay, but in case of heat stroke, the only pointer that this child is having a heat stroke is exposure to hot weather. The child can be presenting with symptoms like confusion. So you are asking the child what's happening, and the child is just talking not in keeping with what is happening around them. So you are speaking with the child, but the child is not really oriented in time, place, and person. You are asking what's your name. The child cannot really give you a coherent answer. Please and please, before you start screaming that village people have gotten to this child, first of all, touch the body of the child. When that situation whereby a child is appearing disoriented, confused, and you touch the body of the child and the temperature is significantly elevated, and the weather temperature in that environment is high, please and please suspect heat stroke. Other presentation the child can have include things like dizziness, lightheadedness, they feel dizzy. At times they can present with fainting. At times they can present with seizures, involuntary abnormal jerking movement of the body. At times they can present with unconsciousness. So in such situation, you touch. That's the major thing. You must touch the body of the baby. It usually used to be very hot. And that's why it's advised that every family should have a thermometer. In this situation, touching is not enough. You need to check what is the temperature reading. When you place your thermometer underneath the armpit of the child and you get a reading, you're getting 40 degrees and above. Please and please, activate emergency medical services immediately or make plans to get to the hospital as soon as possible. But while you are doing all this, please and please, first and foremost, remove excessive clothing on the child. You've taken off the clothes of the child. Place the child under cool running water. Okay, ensuring that the water is getting to every part of the child, especially the neck, under the armpits, and the groin. The groin is the area, the private part area. You allow the child to stay there for 20 to 30 minutes, or you stop when you notice the child begins to shiver. If the child is shivering, you stop. You quickly remove the child and clean the child with a clean cloth. If you don't have access to cool running water, you get a bowl of cool water and place the child in it. Let the child be immersed in it, of course, with the head above the water. Okay, but let the child be immersed in the cool water while you continue to also clean, paying attention to the neck, under the armpit, and the groin area. You have to be monitoring the child because even though you're trying to crash the body temperature, you still do not want to overcrash it in such a way that the child will tilt into hypothermia, which is very low body temperature. So remember that you've activated emergency medical services or you've called for a driver that will get you to the hospital. What you are doing is to reduce the body temperature as soon as possible before you get to the hospital or before emergency medical services arrive. I hope this video helps someone out there. Share this video so that together we can help save many lives.